wait for like 2 more minutes for anyone else who wishes to join, and then we can start at 7. So I'll start exactly at 7:02. For educational purposes. So I'll be recording this session, and later on you can also access this session on my YouTube channel. If you have any questions during the session, you can unmute yourself, raise your hand, or you can just, type in the chat box, whatever is easy for you. So, as most of you know me by now, I have done a couple of classes regarding the NAC OSCE scenarios. So, I will not be wasting any time on introducing myself once again. We will just proceed towards today's task. But just to let you know that in the previous sections, as you know, we discussed about a lot of things regarding history and how the NAC OSCE stations are, and how should we utilize the time outside the door in a very effective way in order to decide our goal once we are inside the room. So we have done those things a couple of times. If any one of you have any questions regarding that, you can ask me. So today I will be focusing on this part, okay? This is the NAC OSCE practice scenario. So as you all know me, I won't be introducing myself right now. And I'll just go ahead. We all know by now that what is NAC. If anyone has any questions regarding the structure or anything, you can write a message in the chat box or raise your hand and I can go through this again. But I think by now, like exam is just a couple of more months. The exam is right there. So I won't be going into details of all these things. If anyone is new or does not know what it is, you can always raise your hand and I can go through this again very quickly. Okay. So this slide focuses on the time division that you have outside the door. So this is our first scenario of the day. And I would just like to know if any one of you would like to volunteer for this scenario. Anyone who would like to perform this scenario? I can give you the prompts if you have any confusions. No one? You don't have to turn your cameras on if that is an issue. Okay. So no one is brave enough right now? Okay. So I think I will have to handle it single-handedly probably. Oh, I have something in the chat box, I hope. The recording is stopped. Oh, let me see. Wait a minute. What's wrong with the recording? Okay, I'll restart it now. Okay, I think it's recording now. Yeah. Okay. So nobody wants to volunteer for the ethical scenario? Okay, no worries. We can just go ahead.
Dr.
Yeah.
Sana, I think I would like to volunteer.
That is very good. Afira, your name is Afira, right?
Afira, yeah.
Afira, okay. Yeah, Afira, the first thing to excel in your NAC is come over your fears. So that is the best thing that you can do. Perform as much as you can. Like just go and look out for all the opportunities where you can go ahead and perform. That will take you out of your comfort zone, and that is what is needed for the NAC. Okay.
Yeah,
So,
thank you. I will try my best. Yeah.
Yes. We are all here to learn, so you don't have to worry. There is just go with the flow and with your natural instincts, and then we can work together towards making it better. So this scenario is about a pulmonary nodule, and this scenario is about a patient. He's 62-year-old Kevin Austin. He was visiting you for a scheduled appointment for follow-up on his hypertension, okay? So he was just visiting you for his hypertension. And while reviewing his charts, you realize that an X-ray was done 6 months ago and it showed a nodule, and follow-up CT was recommended by the radiologist. But there was no follow-up done by you. Now you have to talk to this patient in the next 11 minutes. So, Afira, you can take 2 minutes to write your basic points that you want to go ahead with. If you have any template in mind, I usually tell my students a template, but if you have anything in mind, you can go ahead and then we can work together. If you need any help, any prompts, anything, let me know. Okay.
Yeah, sure.
Okay. So I'll give you 2 minutes now. And after 2 minutes, we'll start the session. Okay, so the 2 minutes are done. Are you ready, Afir, or you need some more time?
No, I'm ready.
Okay, good.
Yeah.
And these 2 minutes that I always mention in my classes that these 2 minutes are not actually 2 minutes, they are 1.5 minutes when it comes to an actual scenario, because 30 seconds are just wasted when you are moving from one station to the other. Okay, so when you're practicing in real life with your study partner, try to write everything in 1.5 minutes. Try to develop the reflexes. Okay. Okay, so
Right.
yeah, you can
Perfect. Thank
start
you.
now.
Yeah. Knock, knock. I will sanitize my hand, greet the examiner. And hi, I'm Dr. Naz. Can you please confirm your name and age, please? Age with
Uh,
me?
yes, doctor, I'm Kevin, and I'm 62-year-old.
Right. Hi, Kevin. So I am the physician on duty today. How would you like me to address you?
You can just call me Kevin.
Right. Kevin, tell me why you're here. What are your concerns today?
Yeah, doctor, I just came for my regular checkup, regarding my blood pressure. So I just wanted you to have a look that everything is going fine and everything is right. It's just my regular routine checkup with you today.
Yeah, that's nice. And thank you for coming. I was just looking at your records, your blood pressure and your last few tests you have done. Um, do you remember that you have recently gone through some blood test or in X-rays?
Yeah, doctor, like a few months back, I remember that you did some x-rays.
Mm-hmm.
Yeah.
What do you know about that? Did anybody talk to you about that X-ray?
No, you just told me that if everything is okay, I won't get a call from the office. So I didn't get any call from the office, and I thought that, everything is fine.
Right. So, when was that X-ray done? Do you remember?
A couple of months back, doctor. I don't remember exactly.
Right. And you said that you didn't receive any call from the doctor?
No, nothing from your office. Yeah.
Right. And do you know anything about the results of that X-ray?
No, doctor, I never followed up because you said that your office will call me, if everything is okay, I won't get a
Mm-hmm.
call. So I just thought that no news is good news. So I didn't
Yeah,
follow up. Yeah.
right. So, Kevin, actually, I was looking at the results of your X-ray, which was done 6 months ago, and they have some significant finding. Are you okay if I share the results with you right now?
Like now, after 6 months, doctor?
Yes. it's important that I share the results with you. I don't know what happened in, and why you didn't get a call, but right now I have those results and I would like to inform you. What do you think about it? Talking about the results right now.
Of course, doctor, I would like to know my results, but my question is that what kind of negligence is this that it was the results were sitting there in your office for 6 months, and now
Mm-hmm.
when I just show up for my regular appointment, now you are telling me that I had some findings?
Yeah, I can completely understand your frustration that it was done 6 months ago and you didn't know anything. I really apologize. I don't know what has happened. I will go back and look into it. But right now, let's talk about the results. Are you okay with that?
No, doctor, I first want to know that who's responsible for this. I need the names. What if I have developed a cancer in this time? Like, can you imagine for 6 months,
Yeah.
whatever the results were, they were just sitting there. Nobody called me from your office, and I'm your regular patient. I'm not just walking in your clinic.
Mm-hmm.
And like
No,
just today, you're telling me that you missed
I
a finding.
completely understand your frustration. I completely understand, and it is valid because you should have known, the results of the X-ray right away. But as I said, that I will definitely look into it. I will talk with my team, and I will come back to you, and we will discuss who was responsible, and I will take care of it. So, but
And
right
I
now.
need I need the name right now, doctor. I need the name. I want to sue that person. Whoever is it you, or is it someone from your team, or is it the radiologist? Whoever is responsible, I need the name right now.
I completely understand that you are frustrated and it is not that should be done. I don't know the name. I'm really sorry about that. I
Then
don't
who
know
will
what
know
has
the name,
happened.
doctor? Like then who will know the name? Like it's your office, you are running it. I'm your patient. Who will know the name if you won't know the name?
No, right now I cannot answer that question, but definitely I will go back, talk to my team, look into that, and I will definitely come back to you. We will make a follow-up appointment, and you have all rights to know that what has happened. And I assure you that I will do my best to give your answers. But right now, the most important thing is your health to know that what is happening, what are those results, because on the basis of those results we need to do some more investigations. So your health is my priority right now.
So, doctor, I can take your word that right now you cannot give me any names, but like when you do the investigation and you find the culprit, you will let me know the name.
Definitely, we will try our best to find out what has happened, and I assure you that I will, talk to you, and I will tell you, and we will discuss that what has happened, what was the negligence, and we can come up with a, plan.
But I will get the name, right? I will get the name of that person who's responsible for all this.
So, Kevin, sometime to point one person is pretty hard, right? There is a system, and we are working as a team. So I cannot say anything right now whether it was one person or it was some technical issues. It's hard to for me to tell you. But I assure you that I'll go back, look into it. I will talk to my team, and I will, discuss this with you.
Okay,
How
doctor,
does it
I take
sound?
your word. Yeah, that
Yeah.
sounds good. Yeah. Okay.
Yeah, so let's talk about the X-rays and the results, which was done 6 months ago. Kevin, it showed a nodule in your lung, right? It's kind of a radiological, can be oval or circular shape structure, and it is surrounded by the normal lungs, but it can be uh, malignancy or it can be just a benign lesion. But to look into this further, we need to do a CT scan. How do you feel about it?
Doctor, I am not being able to process this information because I am right now really frustrated and angry. Like if it's a cancer, you said it can be malignant. If it's a cancer, it was sitting there for 6 months in my body, and I don't know where it is now. It might have been everywhere. I have seen cancer patients dying miserably in my family, and I am unable to process this information right now. I need to change my doctor. I'm sorry, I don't want to take your services anymore.
I understand that it's big use. It's pretty difficult for you, and you can change your doctor, no problem in that. But first, I want you that you understand what I have talked to you. Do you understand what a nodule is? And
Yes, doctor, I understand.
yeah, and then as I said, it can be benign or it can be malignant. On the basis of X-ray, it's very hard to say that whether it's a malignant or benign. I wish and I pray that it's a benign lesion and we can, fix it uh, more easier than anything else. But it is really important that you go for a CT scan as soon as possible so we can find out that whether it's malignant or benign. What do you
Oh,
think about it?
okay, doctor.
Right. I would like to ask about some more, your health. Let's dig into a little bit more. Do you have any symptoms?
Like what, doctor?
Like, for example, chest pain, cough?
Uh, yeah, maybe something, a few episodes of cough here and there, but nothing big.
Is it with phlegm?
Yeah, it's with phlegm.
Okay. How much phlegm do you think in a day? How often it is?
Maybe half a cup in a day. Yeah.
Right. Have you ever noticed any blood in it?
Yes, sometimes.
Right. How is your breathing? Do you have any difficulty in breathing?
It's fine.
Any shortness of breath?
Nothing that I can think of, doctor.
Right. And when you breathe, do you hear any whistling sound?
No.
Okay. Do you have any associative symptoms like fever, chills?
Yeah, I do get fever off and on.
For how long you are having this symptom? For how long?
Maybe of like 4 months, 5 months. Okay, so your
Oh,
time is up, but if you want extra time, you can take that. No worries. Okay.
right. Have you ever checked your fever recently?
No, I just feel tired and feverish.
Right. Any chills?
No.
How's your weight? Have you lost any weight recently?
I've always been thin and lean, doctor. I don't know if I lost weight or not, but I do feel tired. Yeah.
Right. And you did not notice any recent changes in your weight, right?
No.
Right. How's your appetite been?
Appetite is okay.
Right. And any lumps and bumps in your neck or any part of your body?
Nothing that I've noticed.
Right. Any headaches,
No.
nausea or vomiting?
No.
Are you experiencing any pain in your body, especially back?
No.
Weakness in your arms and legs?
No.
Pins or needles or numbness, any part of your body?
No.
Did you notice yellowing of skin,
No.
any itching?
No.
How's your bowel habits?
It's fine.
Right. And what's the color of your stool?
It's just normal the way it is.
What about your urine? Is it good?
Yeah, it's
Are you
fine.
passing urine fine, right? What is the color of your urine?
It's just a normal color, not very dark, not very light, just normal.
Right. I would like to ask you more questions like, do you smoke?
Yes, I do.
How many cigarettes a day?
Maybe a pack or two.
For how long you're smoking, Kevin?
Um, uh, since my teenage, I think, doctor. Yeah, I was maybe 18, 17 when I started.
Right. And it's been a long time you're smoking. Have you ever think of quitting smoking?
No,
Right.
it's my lifeline. That is the only thing that gives me pleasure. And like especially after today's episode, when you missed my findings for 6 months, I'll go and I'll, smoke a pack of cigarettes to feel better. So I cannot let it go.
Right, I understand, but I would like to let you know that smoking can have a very significant impact on your lungs. It can cause cancer, especially lung cancer. So I would, suggest you to quit smoking. And if you want, we have all supports, and I can share that, and we can talk about it. We can do a
Okay.
follow-up appointment about that.
Okay.
Right.
Sure.
I would like to ask you more questions, just to understand a little bit more about it. Are you okay with that?
Sure.
Yeah. Have you traveled recently outside Canada?
No.
Right. Have you, been in contact with any sick person recently?
No.
Right. Any, you said you have fatigue. So, any itching or rash have you noticed on your body?
No. No, doctor, nothing.
Right. Anything else which I missed and you would like to tell me?
Well, you missed my X-ray 6 months back.
Yeah, I'm talking about any symptoms which I missed and you would like to tell me.
No, doctor, nothing.
Right. And I would like to ask about your family or your past medical history. Have you ever diagnosed with any medical disease?
Yeah, I have high blood pressure. That's why I was here.
Right. Diabetes,
No.
any lung diseases like tuberculosis,
No, no, I'm pretty healthy.
sarcoidosis,
No, no, doctor, I'm pretty healthy. Yeah.
asthma,
Nothing.
any cancer? Have you ever diagnosed with any cancers?
No.
Okay, I would like to ask about your family history. For example, your mom and dad and siblings. Have there anyone diagnosed with any medical conditions like cancers,
No.
tuberculosis,
No.
hypertension,
No.
diabetes? Right.
No.
And right. Um, what do you do for a living?
I used to work on shipyards. I used to paint ships.
Mm-hmm. So, do you think you, by any chance, you come in contact with any chemicals or smokes?
Well, my work was all around that, painting the ships and looking after the rust and all that stuff. Yeah.
Do you know what chemicals can be involved in that? Do you know the name of that?
No, doctor. I don't remember now. It has been quite a while. I took an early retirement in my 50s.
Right. Was there any other, colleague who diagnosed with any lung diseases in your when you were working or you know about it?
Maybe I'm not in touch with most of them now.
Mm-hmm. Right. Um, so yeah, whatever we talk about, Kevin, I feel that there can be, few reasons why this nodule is there. But I think, first of all, smoking, it can be, there can be, few causes
Mhm.
which have caused this nodule. But I think first of all, I would like to get this CT done, and then we will, I will, request some blood test, and I think I will also would like to involve respiratory team so we can come up with a diagnosis for you. How does it sound?
Okay, that sounds good, doctor.
Thank you.
Thank you. Okay, Afira. So thank you very much for coming
Thank
forward
you.
and yeah, no, thank you very much for coming forward and doing the case. Now I will dissect the case, one like bite by bite, a bit by bit, and
Sure.
then yeah, we'll do that. But before that, to all the participants on my next screen, you will see a barcode, and if you scan it with your phone, including you, Afira, you guys can rate her. This is normally how I give feedback to my students through the chat box. So I just wanted to, do this today in this class as well. So this would be
Sure.
entire feedback, and this would be anonymous, so you don't have to worry whatever marking you're giving. So this is the barcode. If you can scan it with your phone, and then you can just give points about initial approach, history taking, counseling, empathy and professionalism, communication and patient interaction. Is it working for you guys? If it's working for you, let me know. Okay. Those of you who cannot scan it because they're taking class from their phone, that is fine. It is just, just for a general feedback and just for the class to be involved as well. Okay, so I will move forward now and let's see the results, Safira. Okay, so your initial approach, you got 55%, history taking, you got 85%, counseling, you got 60%, empathy, you got 68%, and communication, you got 81% from the class. So your total was 70.3%. Okay, according
Thank you.
to, yeah, so it was very good. Okay, but there
Thank
are,
you.
yeah, sorry.
Thank you. I said thank you so much. But obviously, there must be many mistakes, and
Yeah, no,
I'm
no, no.
open to learn.
No, there are not many mistakes, just a few things here and there that I need, you to work on.
Mm-hmm.
So yeah, and that's what I'm here for. So for initial approach, it was that you greeted and you did the introduction professionally, you confirmed the patient's name, you ensured the privacy or not. So, all these things, I have a bigger breakdown for my usual class in this. For my usual class, I have a whole template about history, physical exam, and everything. But since it was a different station, so I just chopped it a little bit
Right.
according to this. Okay, so now coming back to your case, Farah. So
Mm-hmm.
your entire history and everything, it took almost 18 minutes. Okay. And the thing is that the history section was very nice. The counseling, the start, everything was good in its own, in its own perspective. But
Mm-hmm.
you actually, on this station, you actually mixed ethics, spikes approach, history taking, smoking cessation counseling, and the what I can say, the general counseling. You
Mm-hmm.
mixed everything up in the station. And
Mm-hmm.
that was the reason that you moved away from your actual task, because this task was actually about accepting your mistake or accepting your mistake as a doctor. Okay.
Mm-hmm.
So
Okay.
if you will focus on, because the history itself, if it was only a history station, the history itself was very good. It was very thorough.
Mm-hmm.
It covered almost all the aspects. Communication by itself, it was very good. But the task of the station was that you had missed a patient's report who is very angry with you. Okay, and you have to calm the patient down, you have to accept your mistake, and you have to do the rapport building. You don't have to break the bad news right now. It was not spikes right now. So a lot of things were there.
Mm-hmm.
So in my view, when the first I will tell what things you were lacking, and then we will discuss that what things can how things can be channeled properly. So whenever the patient came to you, you introduced the patient. Okay, you said, okay, so you're visiting for your hypertension. You did not ask any question about hypertension. Okay, you did not ask the patient that, so how is your blood pressure control now? What medications are you taking?
Mm-hmm.
What are your readings? Okay.
Right.
Okay, so just a brief one or two questions for the thing that the patient is there for. When
Right.
after you're done with that, then you ask the patient that, okay, so yeah, I'm really glad that your blood pressure readings are really in good control. And I appreciate you for the things that you're doing. I think whatever medication and lifestyle changes you're doing, they are working for you. And I'm very happy with your compliance. Okay. When you're done
Right.
with that part, then you move to the next part. Okay. That is about accepting your error. So you just tell the patient, so I was going through your chart, and I saw that we did an X-ray with you 6 months back. So can you recall that why that X-ray was done? Okay, so you throw an open-ended question to the patient. Okay. And
Right.
and you did ask me that, do you remember any uh, labs or any things that were done? But if you just give this one statement, then the
Right.
patient will
Yeah.
give you the bigger part of the story rather than you giving the bigger part of the story. Okay.
Mm-hmm.
That will be more interactive. So you ask the patient, so, I just looked through your chart and I saw that we did an X-ray 6 months back. So can you recall that? Why did we do that? And the patient will tell you, oh yeah, doctor, at that time I had some cough and flame and all that. Okay, so how's your cough now? Okay, so there
Mm-hmm.
and then you start that question rather than going in the history very late.
Mm-hmm.
Over there, when the patient is not angry with you right now, because now in a few minutes you're going to tell that you missed the report and the patient will be angry, and your task will be to calm him down. Okay, at that
Mm-hmm.
point the patient will not give you history. So just tell the patient, okay, so how is your cough now? So he would say, yeah, it got settled or it is still there. Okay, do you have any phlegm with it? Okay, no, yes. Ask about a little bit about constitutional factors and a very brief history. Okay, otherwise you will miss your
Mm-hmm.
station, you will miss your entire time. So have you ever, so but within these 6 months, did you get another X-ray done or any lab work done at any other place other than us? No, doctor, I did not. Okay. And before this X-ray, did you had any previous X-rays? No, never, doctor. Never
Mm-hmm.
previous X-ray. Okay, so I can see you're 62 years old and you have a very strong family history, a very strong history of smoking. So, was there any low dose CT done when you turn 55? So this will give the impression to the examiner that this doctor knows the screening guidelines also, because you are seeing a patient who has been smoking 2 packs of cigarette for since his teenage. So this gives a crisp approach that the doctor is very vigilant. Okay, so just ask the patient, so did you ever get any low dose CT scans in the past, which is recommended, looking at your smoking history and all that. And the patient says, no, no, I'm not that kind of a person, or I got it done, whatever the patient tells you.
Mm-hmm.
Then from there you say, okay, so Kevin, actually, the reports that I went through, they showed that there were some findings in your X-ray, and we needed to do a follow-up for them. But due to some reasons, due to lag in the system, and I don't know what the reason might be, but we could not follow up for that. Okay. And then you pause for a minute. And when the patient is angry, you never say that I'm sorry or I apologize. These two words can put you under the bus. So
Right.
you will not say I'm sorry or I apologize, because that means that you are taking the whole responsibility. Okay.
Mm-hmm.
So you will say I'm equally frustrated or I'm also equally upset. Okay. Things,
Mm-hmm.
words like that. Be very wise with your words on the ethical scenarios, because each word that you are saying to the patient, that can be used against you. So just say that, don't say I apologize. Okay. And when the patient said, a patient asked you, um, like I think 3 or 4 times that, give me the names. So in the third time, I think you replied that there are many people involved in the care. So you can just say that after his first statement, when he said that I need to know the names of the people who are involved. So just tell him that whenever we are taking care of a patient, there are a lot of people who are involved in the circle of care, and it is very hard to put the blame on any one person, and it is not something that anyone would do on purpose. Okay, there are glitches in the system or maybe a communication error, but I will definitely look into this and I will make a note of this. Or you can say, if you're in the hospital, you can say, I'll file an incident report about this and I'll make sure that this does not happen again. Okay, you
Mm-hmm.
have to reassure the patient also. And
Right.
after that, when the patient said that, I want to change my doctor, you said, no problem, you can do that. And then you moved on. No, you will not say it like that, because that means that you're just letting the patient go. You will handle it very nicely and you'll say that, uh, you know, uh, it's your right. If you want to change the doctor, I cannot stop you from that, but it will make me really sad to let you go. And trust me that uh, I will do everything in my capacity, which is best for you. I will try to do everything in my capacity. So, like this, you are letting the patient know that he has the right to choose his doctor and to leave your practice. And at the same time, you are doing whatever is best for him. Okay, but if you just say, okay,
Correct.
no problem, we can change the doctor, that will be like that you're not an empathetic doctor and you don't care. You are just like, okay, you want to go, just go.
Yeah.
Okay. Why are you wasting my time here? So, So just have that, and try to, because he's your patient for years and he's angry, and
Yes.
it's his right to be angry as well, because, he had a nodule sitting there for 6 months and it was missed by us. And
Yeah.
even if it
Mm.
was missed by the patient, sometimes they might also give you a patient who would say, doctor, is it my fault? Is it because of me? So you don't even put a blame on them. Okay. You don't even tell them that, no, yes, it's because of you. So, or you cannot say that you never called us back. Okay,
Mm.
you just tell them that, yeah, we needed to follow up on this, but somehow we missed it. So in the next slide, a few slides, I have chopped down a few things here and there that would be helpful for you guys when you're preparing for this scenario, that you introduce yourself, then you have a smooth transition to blood pressure review, that I've reviewed your blood pressure readings today and they are well within the target. It's great to see that your current plan is working, keep working, and all those things. Then you address the missed follow-up. Okay, that whatever was missed, you address that. Then, if a patient mentions the reasons like cough, etc., address it how it is now. If he doesn't remember, then just proceed with the news that you missed it. Then when you're explaining, then you will tell the patient that this was this and CT was supposed to be done. And yes, while wrapping up, you did a very good thing that you said that we will be doing a CT. So you can just make it more crisp by saying that I will be arranging an urgent. Okay, you say the word urgent so that they know that now you will proceed. I will make an urgent referral for a CT scan, and I will also streamline oncology or anyone who ever needs to be taken care of, or a pulmonologist very urgently. So then these are a few more points that I take the full responsibility for ensuring we get back on track with your care. I'll chalk out a plan for you to just so we can move forward as quickly as possible. So such statements, and then you tell about urgent x-ray, CT scan, whatever the need is. And you can also, if the patient asks you that, do I have a cancer or something, you can just say that, at this point, I don't know. I haven't done your physical exam yet, and I have to run some more investigations. Okay. And all those things. So this is how you will proceed. Regarding the smoking cessation, you mentioned that, have you thought about quitting to smoke? So you can ask that question when you are taking a history, but this is a different scenario. In this, the patient is very angry. You cannot tell the patient at this time that
Mm.
about, yeah, you can just,
I understand. Yeah.
yeah, you can just give one line to the patient that in the end, if you want to, that whenever you're ready, we can also talk about smoking. But at this time, he's so angry, you don't want to bring that thing up. Okay.
Yeah, yeah, I understand. Thank you so much,
Yeah.
Dr. Sana.
Yeah.
It's very valuable to me.
You're
Thank you.
most
I
welcome.
appreciate it.
Okay, so now we have one more scenario, and it is based on Spike's approach. So if anyone would like to volunteer for this, or even if Afira, you also want to go ahead with that, that is perfectly fine. So do we have any volunteers for this today?
If nobody wants, then I can go.
Yeah, sure. That would be great. Okay. So let me. So you have received the reports of your 75-year-old patient, Robert Shamaron, who uh, sorry, that's a typo error, that show findings related to lung cancer. Talk to him in the next 11 minutes. Okay.
So,
So you take your 2 minutes.
right.
Meanwhile, if anyone has any questions, I got one question in the chat box regarding saying sorry, not saying sorry to the patient. So let me know what is your question in that regard. And if there is any other questions, you guys can ask me till Afira is preparing.
Oh, okay. Hi, Dr. Sana. Thank
Yeah.
you for the opportunity.
Welcome.
I'm not sure where I read this from. It could be Toronto Notes or CMPA, but
Mhm.
Canada adopted like an apology act where the doctors can say, I'm sorry, to be empathetic or compassionate with the patient
Mhm.
regarding a mistake done without, admitting for any guilt or any crime, so that the patient can feel, understood or just feel like the doctor understands how the pain.
Okay.
Uh, and yeah, I thought like the doctors can say I'm sorry without
Mhm.
admitting for any guilt.
Okay, I will double check this thing, but when Hindia, but till when I was preparing for QE1, I remember that this was mentioned that in such cases you don't say sorry, the ethical cases, but yes, in the history cases you do say when the patient says I'm having pain, you say I'm so sorry. How are you managing it? Over there, you say
Oh,
that, but yeah, but in such scenarios, what my knowledge and understanding is, and I practice the same in my NAC exam as well. But if this is something
okay,
new, I will double check that. Yeah,
okay.
but like the information last I read was in I think September, October. Okay, so if
Mm,
I will check again, and if you can find that clip, please share that with me as well. I will have
okay, thank you.
yeah, I will double check. But like I know that in ethical scenarios, you don't say the word sorry. But in normal history, when you're being empathetic to the patient, yes, you do say. And that too, not in cases like erectile dysfunction and all those things. You
Mm,
never tell or
oh,
infertility. Yeah, in infertility cases, in erectile dysfunction cases, you don't say, "Oh, I'm so sorry. How are you coping up with this?" Because you
okay.
can, yeah, because that can trigger the patient. It's a sensitive thing. So
Mhm.
that's what I know, but I will double check it. And if you have more information on this, please do share with me. I would love to read on it.
Okay, thank you, doctor.
Yeah, thank you. Okay, so Afira, are you ready?
Yes, I'm ready.
Okay, so start.
Right. Knock, knock. Hi, I will greet the examiner. I will sanitize my hand. Hi, I'm Dr. Nas, physician on duty today. Can you please confirm your age and name?
Yeah, I'm Robert and I'm 75 years old.
Hi. How would you like me to address you?
You can call me Robert.
Hi, Robert. How are you doing today?
Yeah, doctor, I'm fine. I'm doing well.
Mm-hmm.
Mm.
Right. Um, just wanted to ask, or first of all, I would like to tell you that I know we are here to discuss about your health, and whatever we talk will be confidential and private until unless I have to declare it by law. I'm here to support you. Robert, I want to know that how much do you know that um, what we are discussing today?
Yeah, doctor, I just got this call from your office that you have to discuss my, x-rays that were done. Yeah.
Mm-hmm. Right. And yeah, do you remember when did you get those X-rays done?
Yeah, like I think 2 months back, you gave me the requisition.
Yeah, and do you remember why we requested those X-rays?
Yeah, I was having this nasty cough that was not going away.
Mm-hmm. Right. How are you now? How's your cough?
It's still the same, doctor. I mean, I'm still struggling every night to sleep.
Any recent changes, Robert?
Like what, doctor?
Any recent changes in your cough? Any other symptoms? Anything you would like to tell me?
Hmm, I don't know. Nothing that I've noticed, doctor.
Right. And how's your mood, Robert? I know it's been really hard for you. You're not able to sleep, and your cough is so bad. How's your mood?
My mood is okay, but of course, I'm really upset about all this thing. I don't feel 100% all the time. So yeah, mood is okay, but it's manageable. But it's just
Mm,
that I just don't feel good about anything anymore.
No, I understand. It's not easy. It's pretty tough with you. Do you have any support from your family, friends?
Yeah, yeah. I live with my wife, and I have a good circle of friends.
That's really nice. I think good support is really important for the mental health.
Mhm.
And did you discuss this with your wife
What, doctor?
that you are going to talk about X-ray results?
Oh no, we are both of us are pretty much independent, and I
Mhm.
don't like to bother her for such petty things, and same goes for her. So I can manage all this. Yeah.
That's perfectly fine, and that's perfectly fine, and it's
Mhm.
your choice. And I just wanted to ask if you still need someone to be with you right now, or are you okay to discuss about your scan results?
Doctor, is this something to worry about? Like, do I need to call someone?
Robert, yes, I have some news. We have some positive findings in your X-rays, and we might, we need to get your CT scans done and some more, investigations done. So, uh, yes, I have some positive results for you. So I just want to check in if you're okay, comfortable to discuss it today or not.
Okay, doctor. Sure, go ahead.
Yeah. So, Robert, as you know that we have, requested your X-rays, and and I on X-rays, I think you have not done your CT scan, right?
No.
Right. So your X-ray results shown, some findings, which shows that can be cancer, lung cancer.
I have a cancer, doctor.
So we are not pretty sure, but the findings are more, significant and suggestive for lung cancer. And I'm really sorry about it. I know it's a very uh, difficult news for you, but at this point, I would like to tell you that we might need to do a few more. We will definitely need to do a few more investigations, CT scan, to confirm this finding. What do you think about it?
So, doctor, like, I'll die now. I have cancer, and I was not expecting this news today.
Yeah, I understand, and I know that's pretty difficult for you. It doesn't mean that you will die, um, and we are not, 100% sure that it is lung cancer as we have done X-ray, but it's pretty suggestive that can be lung cancer. And we need, as I said, that we need to do some urgent investigation like blood tests, a CT scan, and we have a team of oncologists and also, lung doctors, lung experts. I will, coordinate with them to make sure that we don't miss anything.
Okay, doctor. Okay. Okay. That sounds like a plan. Yeah.
Mm. Do you have any questions?
No, I'm just overwhelmed with all this information. I don't know how to process it.
I know, I know it's pretty difficult, a lot of information, but I don't want to press you. Take your time, think about it. We can, make a follow-up meeting. I can, we can discuss it later. If you have any other questions and any other question come up later when you go home, you can definitely, call us, or we will book a follow-up appointment. I will, request some urgent, CT scan and some other blood tests. So if you have any questions right now, you can.
No, doctor, I don't have any more questions.
Mm-hmm.
I can go now?
Yeah, definitely. How you're feeling? Are you feeling okay right now?
Well, I'm just lost, doctor. I think I will take my time. I'll think about it, but I was not expecting this today. Yeah.
I understand it's a big news, it's a big toll on your mental health too. So I have few resources. We have some, telephone lines where you call and discuss if you are feeling, depressed or anxious. You can call us anytime. There are some community support groups, the people who are going through the same, struggles. So just want to tell you that you are not alone. We are here. There are community, there are support groups. And as you said that your family is also there, your friend, you have a very good circle of family and friends. So um, up to you, if you like, you can discuss with them,
Okay, doctor. I'll think
right?
about it. Yeah. Yeah. Thank you.
Yeah, and then after these investigation, we will see you again and we can discuss our next plan, right?
Sure, doctor. Yeah.
Do you need anything
No, doctor.
right now? Water?
No, I think I'll just go home now and see what I can do about it. Yeah.
Right. Will you go home alone or do you have someone?
No, I'll go alone. I came by
Right.
myself.
Did you drive here?
Yeah, I drove here.
Yeah. So you okay driving back home?
Yes.
Right. Right, Robert. Anything else which I miss and which you like to discuss?
No, doctor. That's fine.
Right. Thank you, Robert. Thank you so much and take care of yourself. Any point you need to discuss anything, don't feel free to call us back, right?
Yeah,
And these
sure.
are some resources you can use it.
Okay. Thank you,
I
doctor.
just want to tell you that you are not alone, right?
Thank you, doctor. Thank you for your
Thank you.
support.
Bye. Bye.
Okay, thank you. So, Afira, that was very well done. And you covered almost all points very nicely. So, once again, if we can use this barcode, if everyone can use this barcode, and we can see what results we get.
Right.
I hope it's working for everyone. Okay, so I have the results and I'll move it forward. Okay. Wow, Afira, you rocked
Yes.
it.
Yes.
Okay, so initial approach 85%,
Good news.
history taking 83, counseling
Mhm.
was very good, yes, 89, and empathy 90, and communication 93. So yes, you did a very good job on this
Thank you,
statement.
everyone. Thank you, Dr. Sana.
You're welcome. And there's nothing much that, I have to add to this. I will just go through a few points here and there. And, I was waiting till the end about the driving safety. And when you brought that up, that made me so happy. I said, oh,
Right.
yeah,
Thank you.
yeah. I was waiting till last moment that will she bring driving safety? I hope she brings us driving safety as well. And support system, you were already exploring it
Yeah.
very nicely. So yeah, so this is a spikes approach that we use to break the bad news. And what we do is that we first set up the interview. Okay, we ensure privacy the way you did. And then before we begin, is there anyone you'd like to have with you for this conversation? You covered this
Mm.
point, and did you come by yourself or did somebody accompany you? So you asked that in the end, but that is fine. Or you can go in any.
Yeah.
Okay, and then there was perception. Perception is that what the patient is thinking, why the patient is there for. One thing that I would just like to you to add is, because you were able to finish in 8-9 minutes, so you can
Mm.
add a few history points of Mets, especially related to Mets. That when you
Right.
ask the cuff questions, you can also ask that, do you have any back pain, yellow discoloration,
Mm.
and all those, just to see the Mets and the risk factors for lung cancer, like occupation and smoking. Just briefly touch on that because it's not something that you have to dig into. Uh,
Mm.
then invitation. Invitation means that you have to ask the patient that, how much knowledge does the patient want? Does the patient, like, when it comes to medical knowledge, what is your preference? Would you like me to share all the details with you, or would you prefer that we go step by step? So you need to ask this question to the patient, because usually they say, yes, I want to know everything, but this is just a, protocol that we have to follow.
Mm. Right.
And
Did
then
I miss it,
yeah,
Dr. Sir?
you missed this point. You did
Yeah.
not ask that, how much knowledge patient
Mm.
needs, wants to go have of the, whatever information you're giving. And then you mentioned that the X-ray showed this and all that stuff. And then you acknowledge the emotions as well, that I can see that this is overwhelming, and we are here to help you, support you, and all those things. And
Mm.
then, yeah, you chalked out the plan also very nicely. So you mentioned everything that, we'll go for a CT. I will involve the lung doctors, and you have specialized therapists, chronic disease management unit is there. And then you also mentioned about, the mental health. So yes, you
Mm.
covered all those things.
Uh, just
Yeah.
I have a question that I did not mention multidisciplinary team. Should I or
Right now, there is no
right
need,
now?
like we don't
Mm.
need to involve them right now, because we don't know that it's benign or malignant.
Yeah, yeah,
But you
right.
can just mention it, that if, if something comes up, we have multidisciplinary approach towards things, and we give, so
Mm.
you can just give that suggestion that, we have that, so that
Right,
the
right.
examiner knows that you know that part. For example, this chronic disease management nurses that we have, the chronic disease management unit. At this point, even if you don't mention, that's not a problem, but mentioning that will give you some extra points. The examiner will
Right.
know that they know all the aspects of the, Canadian system, and how everything works in the
Mm.
Canadian system and everything. Okay. Then you asked about the, do you have any questions? And then you ensured safety, arriving safety on the way back home. So that was very nicely done. You can also, if you feel that the patient is very upset, you can also ask about, like, financial support, that, how are you supporting yourself financially?
Mm.
And if there is another scenario in which it's a short case of lung cancer or any cancer, and for example, the patient needs to go for the surgery or anything, then you can explore the support and financial aspects more, especially in case of elderly patients, that how will you support yourself after the surgery, or after, do you have anyone to drive you to the appointments, all those
Mm.
things. And if patient says that, no, I have trouble with everything, you can connect them to social workers. You can mention that
Right.
I can connect you to social workers and all that.
Mm.
So then you closed it also very nicely, that don't hesitate to reach out. I'll keep you updated on the next steps as soon as possible, and you're not alone. So that's it. Now this is the detail of the course that I'm offering for NAC OSCE. Currently my session is running on the weekends. We have covered, I think, two classes. No, tomorrow is our second class, and these are the timings. Weekdays, I do 2 times a week. I'm thinking to start another batch. Some of you mentioned or asked me that if I'll be starting a batch in March and April for the May exam. So for the people who are going ahead in the May for the May exam, I would recommend that please take the course earlier. You need some time to practice on your own. So for that reason, I'm thinking to merge one more batch in February, but on the weekdays. It will be different from my weekend batch. On the weekdays in the morning, 9:30 to 12:30 Mountain Standard Time, I can do that. And on weekends, I already have a batch running from 11 to 2. on Saturdays and Sundays. And the fee for the entire course is 400. And I plan to cover 140 to 160 high yield questions. I provide with the notes, and I provide with post and counter probes and examiner's checklist and the feedback as well. And number of students in each batch is not more than 12, because I feel that that compromises on the performance of the students. And these are the units that I'll be covering in the course. There are 16 classes, as you can see. And if you have any other comments or you need a detailed description of anything, you can let me know. You can reach out to me at medicinebyheart@gmail.com, and this is the link to my Telegram channel. And this video and some previous videos are already on the YouTube channel. You guys can see them there. Now, somebody asked me about one of the slides, so I'll just go back and show that to them. Sorry, I have a you'll be doing these courses for September. Yes, I will be doing it for September as well. Yes. First, if the September people, you want to join earlier, like just for observation, in late Feb, yes, you can. So those who are asking about my classes in the late Feb, if you are going for May exam, please let me know, because then I will start in somewhere in the middle of the February, or maybe in the beginning of the February, because I want you to have at least some time to yourself to practice with your study partners. I don't want to, yeah, for May. So I think if you're going ahead for May, you should be starting with me. If you can start now, that is the best, but not now, then you can start from February. I can start, if I get enough number of students, I can start from February, so that you are done by the end of March with your course. And then you have April to yourself. At least 1 month, you do need 1 month to prepare and to practice everything and to practice the scenarios. Yeah. So sorry, one session has passed. No, one session has not passed from this course yet. The session has just started. Just one class has passed. Like I started on 11th of January, and we covered GI classes. GI classes were 2.5 GI classes. So 2 classes were done on last weekend, and the rest of the half class will be tomorrow. It's merged with RESP. And one more thing, that to my students, I send my recorded classes. They are only for them. Like, I send a private link to them, and they have the access to the whole 3-hour class. So if anyone has missed any part of the class or anything, they can always access that. Okay, so sorry, someone asked me about some slide in, let me go back. Was it this slide? This one? Was it this one? You're welcome. First case, last slide. Is it this one? The whole first case? Last slide. It is last slide, the counseling script. Is it this one, or you need another one? Okay. So this is the last, this was the last slide of the first question. Yeah, that's it, I think. The previous slide as well. Okay. Here is the, why it's not moving. 1 minute. Just 1 second. This one. Once going back. Yeah, someone has asked me that, do I teach physical examination? Yes, I give verbal notes, like what you will say to the patient, and the practice that unfortunately you have to do it by yourself, because it's not in person, it's online, but I give the whole script that, for example, if it's cardiovascular system, I will give you the whole script that can I have the set of vitals. I will now be, starting with peripheral examination. I'm looking for this. I'm inspecting the chest. I'm looking for heart sounds, looking for this. Or for abdominal examination, I write everything like McBurney's point and SWAS test and everything. So I give a written script that you have to learn. And while you are doing the examination, you have to say that. So I give the script. Even for the counseling sessions, I give the entire script. Okay, so previous slide, I cannot go back. I don't know what's wrong with it. Let me check from here if I can go back to from the main presentation. Is there a crash course before? Yes, I'm planning one in April, a crash course and mock exams. I'm planning that for the month of April for the May students. And if, yes, one more thing, if any of my students are enrolled in one course, they're more than welcome to observe if they, for example, they missed any class due to some commitment or something. And if another session is running, they can always send me a message and pop into that session and observe that. So that is also something for them. So yes, Kate, if I get enough students for the weekday classes, you can definitely switch. I know you are in the weekend course. A lot of other students have messaged me as well. Register in that class. Yeah, anyone can register who's going ahead for NAC OSCE. Anyone can come. Yeah, it's just that I just want to have the enough number of students because I feel that it's not fair that I just start the class and I don't have enough students. So if I have enough students in the batch, because you learn from each other as well. So at least if I have like 7 to 10 students, I will start the weekday batch and then you can always switch there. Yeah, and anyone can register. You can just drop me a message and I can send you the details how to register for the batch. Okay, sorry, somebody asked me about a slide and I missed it while talking.